For the first time in nearly 50 years, doctors in Indiana are banned from performing abortions, and there are only a few exceptions. The state's new abortion law went into effect at midnight. The exceptions to the near total ban are for rape and incest before 10 weeks post-fertilization, to protect the health of the mother, and if a fetus is diagnosed with a deadly anomaly.
With Indiana's abortion ban in effect, abortion providers in Illinois are seeing an influx of patients already. WRTV State House reporter Meredith Hackler found out how they are preparing and how nonprofits in Indiana are helping women cross state lines.
The cost of an abortion can be anywhere from $750 to $1,000, and elective abortions are rarely covered by insurance. Now, with the abortion ban in full effect, abortion funds say they are helping more women cross state lines to seek an abortion than ever before.
Thanks for calling All Options. This is Jess. How may I help you?
It's just a normal day of the week at the All Options Pregnancy Resource Center in Bloomington.
Okay, which Planned Parenthood are you going to?
Jessica Marchbank is fielding phone calls from people seeking help in paying for their abortion.
I don't want you to be worrying like whether or not you'll get any funding. You will get some, but I won't be able to tell you how much until I look at your application.
She runs the Hoosier Abortion Fund, which has been in existence since 2015.
A busy week for the fund would have looked like 30 applications, 30 people leaving voicemails and saying, I need funding. And now we're averaging 90 to 100 every week.
That increase in call volume has been taking place ever since Roe v. Wade was overturned. All Options Pregnancy Resource Center expects those calls to continue increasing, along with the funding they're providing to women in need of abortions.
I will text you a link to our application.
The Resource Center says in April of this year, they pledged $19,000, which helped fund just over 100 abortions. Last month, they pledged $90,000 to 370 people.
I talk to people every single day who say, I cannot afford to have another baby, either because of my health or because I can't afford the children that I already have. But I also can't afford to have an abortion, or I can't find a way to get to Illinois. And the ban that our lawmakers have insisted upon is going to place so many families under undue burden.
Across state lines in Illinois, abortion providers like Planned Parenthood have already been seeing more out-of-state patients. They've increased the number of clinics they have and the amount of staff they've hired. How big of an increase have you seen?
Overall, over the past 2 months since the decision, about 30% of all of the abortion patients that we see at PPIL come from a state outside of Illinois. And that's compared to prior to the decision, it was around like 6% every month.
Projections from Planned Parenthood predict that they will see around 20 to 30,000 more abortion patients every year. That's on top of what they already handle. They expect to see more people seeking them for medical and sometimes life-saving reasons as well.
We have patients who are sitting in an emergency room with an ectopic pregnancy for hours while their doctor is consulting with the hospital's lawyers about whether or not they can give care to that patient.
Back in Indiana, Jessica Marchbank plans to continue helping women seeking abortions, no matter what happens.
They have really underestimated the dire economic consequences of the choices they've made. And the people of Indiana are going to suffer, and that is on our lawmakers.
All Options Pregnancy Resource Center also provides free diapers and other supplies that mothers may need. The program manager says she will continue to help all women on their pregnancy journey, including ones that may be seeking an abortion. Working for you, Meredith Hackler, WRTV.